We've been working with ORCHA for quite a number of years in Lancashire and South Cumbria. So ORCHA is really a big part of our digital health literacy work, enabling people to have access to safe and reliable apps and digital technologies that will do what it says on the tin, so to speak. So using apps is a really easy way to support our patients and our citizens to engage in the digital experience.
From our side of it, it's how do we offer the best service from our side in terms of providing the participant or the patient with as much support as possible. Definitely become a real useful tool for educators and health professionals throughout Lancashire, South Cumbria to use to help their patients, participants with various health issues.
So I was diagnosed with pre-diabetes, or as pre-diabetic, I think they call it, back in August. So on one of these calls, it was focusing on exercise that week. The educator introduced us to this app called Active 10. So I've completely changed my diet and I exercise a lot. I probably wouldn't even have thought to download a health app. It just wouldn't occur to me. But now I've seen the success of this, and I do put my weight loss and therefore I hope healthier lifestyle down solely to the Active 10 app. Actually, it's very positive. It's shown to me how quickly I can build up the fitness, because now I can go for about an hour and a half walking briskly. So apart from losing weight, which was one of the main things to help with the diabetes prevention, I am aerobically a lot fitter now. So all of the apps that have been recommended on the programme are very easy to use. I don't mind using different apps now. I perhaps would have shied away from anything. I'm a bit old school for having all these apps on their phones like the youngsters. They're all very easy to use, and they do help you make healthier choices and manage your lifestyle.
The main benefit we see is giving our participants another tool of support. So them having their own accountability, responsibility for their health by having an app as a tool to measure their steps or their calories, for example, is really useful for them to have. We offer resources, obviously the sessions and the community and the groups and stuff, but offering this as an extra add-on is going that extra bit more.
It was through a health check at the doctor's, got onto the programme and then linked with the app from there. The recommendation process was really helpful. We recommended the NHS Food Scanner app, and I used it, well initially I used it to scan everything that I had in my house, which was interesting, and that was a learning curve. And then I use it when I go shopping now. I've gone from being in the pre-diabetic range, and I'm now below the pre-diabetic range. I've made a lot of minor changes, and the minor changes, I've been surprised, have made me feel better, have made me feel more healthy. A lot of my generation are very dubious with all these apps. I went from being dubious to being totally committed to using it, and I find it really, really useful now. Have a go with it, use it, and you'll learn from it.
Recommending apps is definitely the way of the future.
Why not use it? It's just going to make your job easier, and it will make the patient, the participant's journey a lot easier. It gives them another tool, it keeps them accountable, it keeps them focused on a goal or a target. You're not using it, why not?